Hello there, a very good evening and many thanks for staying with us right here on NTV Uganda. My name is Romeo Busiku. Well, today is World Rabies Day. Rabies is a zoonotic disease just like COVID-19, the coronavirus pandemic. But guess this, we are getting information that rabies is not getting the same attention just like COVID-19 because even rabies has a 100% fatality rate. Yes, in Africa, in some developing countries within Asia and also Southern America. Get this, in 1 year, 15 million people get the rabies post-exposure treatment to be able to ward off the effects of rabies in that case. And when it comes to animals, yes, animals over 10,500 are killed as a result of rabies. That's only in Africa. But when you go to Asia, that number is double. 20,000 animals die as a result of rabies. Even the humans, those who are actually affected by rabies, die. Yes, they die as a result of the rabies. So what are some of the animals that lead to rabies? We have the dogs. Yes, the dogs. If a dog bites you, you end up with rabies. A cat. Yes, a bat. But then the most common cases within Africa, we have the dogs that are causing rabies in that regard. And that's why today on World Rabies Day, yes, it's a global event that helps us to, enhance advocacy on rabies control and also create awareness or heighten awareness creation and also some campaigns on vaccination in that regard. So I have three veterinary doctors. One is Dr. Anna Rose Adamon. She's from the Ministry of Agriculture, Animal Industry and Fisheries. We also do have Dr. Sylvia Baluka Anguboa. She is the president of the Uganda Veterinary Association. And I also do have Dr. Wilfred Opira. But before I unveil them one by one, let me just continue with this brief preamble. It's really, really, really important that people start to get serious on the issue of rabies. That's why we are here with these three veterinary doctors to help us understand why is rabies neglected, yet it has 100% fatality cases just like COVID-19. So let me unveil my guests one by one and with whom we are going to be sharing this conversation so that we can create awareness on this same disease. So from left to right, I have Dr. Anna Rose Adamon. She is a commissioner, Animal Health at the Ministry of Agriculture, Animal Industry and Fisheries. In the middle there, you have Dr. Wilfred Opira. He's a regulatory officer at the National Drug Authority. And lastly, I have Dr. Sylvia Baluka Anguboa. She's the president of the Uganda Veterinary Association, with whom we are going to be discussing the contentious issue of rabies that has been neglected, yet it is as dangerous as the COVID-19 zoonotic disease. Let me start with you, the commissioner of Animal Health at the Ministry of Agriculture, Animal Industry and Fisheries. Help us understand, Dr. Anna Rosa de Moon, what is rabies?
Good evening, viewers, and thank you very much, Romeo, for bringing us here. Rabies is a viral disease. It's caused by a virus. It affects all warm-blooded animals. That includes human beings, cattle, wild animals like buffaloes. So all those are species that we call a susceptible species. So the susceptible species are so many, and therefore the total population of the susceptible are large. Rabies is a disease, like I said, viral. It affects the brain. It causes what we call like madness in the dog. The dog gets mad. It backs a lot. It's not resting, and it changes its character. And therefore, in that process of changing character, it bites people, it bites animals, and so on. So the most common contact we have with rabid animals is actually the rabid dog. But
the domestic dogs.
Domestic dogs,
all right.
Yes. So the domestic dogs, but human beings, when they are affected, can also bite another human being, and they can be affected, and other animals as well. But the commonest one is the dog. So that's why the target is dog. So it transmits this disease. Once the animal, an affected animal, bites a human being or other animals, they are vaccinable, so they can be vaccinated against. But if this vaccination is not done, once the clinical signs start on this animal, on the human being. That is 100%, where we say 100% death. About rabies being a neglected disease, it's just that, like now compared to corona, corona has brought everybody to his or her knees. Everybody is scared because of the death rate. But rabies has been killing. It's an old disease.
15 million, that's a big number.
Yes.
People getting infected.
Per year. Yes. So that is the rate at which it kills. So you find that because of the comparison of the death, the number of death, COVID-19 seems scary as compared to rabies. So we are all scared. We are all stayed at home because of COVID-19, and yet rabies has been there, equally scary, biting especially, killing especially children, because those are the ones that interact a lot with the dog population.
And you also mentioned something that was really contentious, because so many people thought if you were to get rabies, you have to be bitten by a dog, either a cat or a bat. But then you also said even the infected human being, if he bites another person, they'll end up with rabies. Help us understand how that comes about.
The point is, once the warm-blooded animal, which includes a human being, is infected, the virus goes from the area of bite slowly through the nervous system to the brain, and from the brain the virus is of course multiplying, and it goes to the salivary glands. That's what we call a predilection site, where the site of that virus, where the virus is in, goes as per its nature. So its distribution therefore is by biting, and the saliva has the virus, and therefore a human being who has been affected by rabies can transmit this rabies. It has happened whereby a parent was nursing the daughter who was rabid and was cleaning the froth from the mouth. Then the teeth cut the fingers of the mother, and the person got affected.
Wow.
Unfortunately, rabies will not show immediately. So from the fingers where the teeth had bitten, it took some time for the virus to multiply and go up the nervous system and go to the brain of the mother. Then after sometimes two weeks, 3 months, then the person starts showing the clinical picture. And that's unfortunately when people now wake up to realize that actually the daughter was suffering from the same clinical picture, showed the same clinical picture, and the mother is now suffering from, and then they will trace back that the daughter had been bitten by a dog that was killed by the population or disappeared. So that is how scary rabies is. And of course the picture, the clinical picture is so bad. It's a central nervous system or the brain disease. So the person is mad, no longer articulating their understanding, and disorganized and disoriented. So it's a very bad picture. Sometimes they can't even swallow, and therefore because they cannot swallow, the saliva is coming out. So it's a bad picture. If you see a picture of a person dying of rabies, it's really scary.
Dr. Anna Rose Ademoun is the Commissioner of Animal Health at the Ministry of Agriculture, Animal Industry and Fisheries. If you're just joining us, we're talking about the issue of rabies, and it coincides with World Rabies Day. And on this day, we are observing this day under the theme, yes, end rabies, collaborate and vaccinate. Am I right?
Yes.
Of course. Let me also bring in Dr. Sylvia Ambugua Baluka. She is the president of the Uganda Veterinary Association. We would like to know the origin of the World Rabies Day celebrations. Dr. Sylvia.
Thank you so much, Rami. To our viewers and all those that are following on social media, World Rabies Day was first earmarked and commemorated in 2007. We have what we call the tripartite organizations that are at the forefront on addressing the health challenges, the global health challenges. These include the World Organization for Animal Health, or OIE, and then World Health Organization, abbreviated WHO, and then Food and Agriculture Organization of the United Nations. They came together and they agreed that something needed to be done, in as far as increasing awareness about rabies is concerned. They realized that the disease was neglected, and yet the disease is still claiming lives. The disease is preventable, and yet killing 100% of all the human beings that present the clinical signs, the nervous clinical signs that our Chief Veterinary Officer has already described. They said something needs to be done. So the tripartite organizations came together. They called upon the global leaders, national leaders, different governments to come on board, and they were looking for synergies. They were looking for collaboration. From the very start in 2007, collaboration was at the heart. They realized that rabies affects not only the victim who is bitten. In any case, rabies affects the vulnerable groups, including the children and the elderly, are more affected, and those who can't defend themselves. Sometimes men, especially youthful men who are still strong, we think that they are able to fight off a rabid dog and defend themselves. But the weaker you are, the more vulnerable you are. Although recently I've also heard that a dog beat an athletic member of parliament. It has beaten 25-year-olds, men who are strong and able-bodied. So I think it depends on how rabid a dog is. But actually, if you find a very rabid dog, I think nobody is safe. So these people came together, and they said it was important to collaborate as various stakeholders who have interest in global health. They realized this was a matter of global health, which should not just be left to individuals, to individual governments or communities that are affected. So that's when this day was set apart. Actually, the day falls on the 28th of September every year. But nationally, the whole week, we use this whole week, we carry out different activities to commemorate the World Rabies Day. And the purpose is actually awareness creation, public education, and then also trying to call upon the different stakeholders. Would like to synergize, would like to coalesce different efforts from the human health side, from the animal health side, from the environmental health side, wildlife, political leaders, community leaders, local leaders, traditional leaders. So we use this occasion to try and rally different people and different institutions who are actually interested in global health to come together. So the whole week running towards September 28th gives us opportunity to do that annually. And every year we carry out different activities to educate. Our coming here partly is to educate, to let people know that rabies is a killer disease. We should no longer be silent about it. We should no longer leave it to the veterinarians or the dog owners. We should not leave it to government and blame government entirely, but we would like the different people, different institutions, general public to know that each one of us has a role. We can do something. If I'm a dog owner, I have a role to play. If I am a Kampala State Authority official, I have a role to play. Because urban sanitation is one of the key things that we emphasize during this week. If we keep our cities clean, if we keep our homes clean, we don't throw bones around, remaining meat around, a lot of waste everywhere, dogs will not migrate. But dogs have a very strong sense of smell. So when we are dirty, especially we have bones and whatever meat is being roasted left and right, nobody has earmarked where meat should be roasted. And all these bones are just thrown behind people's backs after they finish eating.
I see.
That means that the dogs are always sniffing.
Yes.
Even if we use poison, which many of us don't believe in, we don't think it's right for us to use poison to kill these dogs. Even if we poison all the dogs in Kampala City now, within 3 months we shall have a new population. For as long as...
But why so?
As long as our sanitation remains poor, our habits remain poor, we buy meat, chicken along the way as we board the taxi, and as we eat, we keep throwing bones through the windows. The people roasting this chicken are not required to have a garbage bin to make sure that all their customers, every bone is actually being disposed of correctly. And also some of our health facilities, they throw out human tissues. Sometimes human tissues are found littered in places, even around health facilities, around hospitals. For as long as that happens, these dogs, their sense of smell for meat will always bring them. That's why we are saying killing is not enough. This year the theme is End Rabies, Collaborate, Vaccinate. For as long as we collaborate and we undertake certain interventions, and then we, at the same time we vaccinate, all the animals at risk, and also the human beings at risk.
Before I bring in Mr. Opira Wilfred to talk about how rabies is controlled, let me still engage you on the issue of rabies as far as the economic consequences are concerned. The effect of rabies on the household and the whole economy of Uganda. People don't believe that rabies can have very, very, very bad effects on our households and economies, because like I mentioned in my preamble, 10,500 cattle are killed every year. In Asia, it's double the number. So help the viewer understand how rabies can have debilitating effects on the household and also the economy at large.
Thank you so much. Rabies has a severe, not only economic, but socio-economic impact on the affected household. As I said, most of the time, the victims who are bitten by dogs are the vulnerable groups, either the elderly who are quite weak or the children who are too young to fend for treatment for themselves. So it will require a mother and father to look for treatment. And many times, people have to travel to Kampala. Many health facilities around our country do not have this post-exposure prophylaxis for rabies. So they have to travel to Kampala. And many of them don't have accommodation here in Kampala. They may not even have a relative. So there is a cost on communication. I get many calls from people asking, where do we go? You begin with the calls, the airtime, then they put in the transport to board the bus and come to Kampala. Sometimes they have to, then when they usually go to Entebbe, Grade A hospital, and even after that they may have to pay for accommodation somewhere in a guest house and then travel back. And usually post-exposure they have to come back several times, it will not be once, and all those are costs. And when of course they travel, they have to eat, they still have to communicate. If they know where the hospital is, they have to use border, they still need airtime, all those are costs. And then of course pay the cost for the post-exposure immunoglobulin. Then we have the other costs, actually, communities affected, not just a household. People live in fear for long. As Madam Commissioner said, incubation period is variable, very variable. It's one of the diseases with a very varying incubation period. We are told that the most commonest range is 21 days to 28 days after someone is bitten by a rabid dog. The person will start to show those nervous signs that the person actually has rabies, and most of the time when that happens, we are sure that death is coming 100%. Now, apart from that range of 21 to 28 days, some people take months, as she said, 3 months, some 6 months, some even longer. And because of that, it's very confusing. And because of that, the household lives in fear for long. Man hours that should be going into labor, either in the garden or something, those man hours are lost. People are no longer working. When your child has been bitten by a dog, you are looking for solutions. Some go to the vet, the nearest vet. The nearest vet says, go to the health facility, the human health. Then when they get there, they are told at the health center too, we don't have the vaccine. You have to go to Entebbe, you have to go somewhere. So within all those movements, a lot of hours are lost. People are not working, people are not productive. Then people go to the religious leaders, they go to the MPs, and if you are an MP and they looked for you to take someone's child who was bitten by a dog for treatment and you disappeared, you never picked your phone call, when it comes to the next elections, the primaries, you know what will happen. So it has, the impacts are quite far-reaching.
Indeed.
And I would like to lastly say that rabies actually is killing more people. But because in Uganda we have an excuse of witchcraft. Whatever you can't explain is witchcraft killing the person.
Are people still blaming that on witchcraft?
Yes, even in cases of rabies, they say it is witchcraft. Even the dog was witchcraft, an act of witchcraft.
Ladies and gentlemen, if you're just watching, if you're just joining us right here on NTV Uganda, we are talking about World Rabies Day. It's a global event that enhances advocacy for rabies control and also provides for an opportunity to heighten awareness creation and also vaccination campaigns. The theme for this year is End Rabies, Collaborate and Vaccinate. I also have a regulatory officer from the National Drug Authority, that is Dr. Wilfred Opira, and I would like to task him to tell us how is the National Drug Authority working to control rabies in that regard. Dr. Wilfred Opira, the floor is all yours. How is rabies controlled in Uganda?
Thank you, Romeo. Good evening, viewers. Rabies being a deadly disease which kills both human and animals, we have control measures that has already been highlighted on vaccination. Vaccination has been proven to be one of the most effective way of controlling the disease. So, National Drug Authority, where do we come in? in order for an effective vaccination to happen, we have to ensure that the vaccines that are being used meets the minimum quality standards. The vaccine has to be safe, not only for the animal which is receiving the vaccine, the handler of the vaccine also has to be safe, and even the environment should be safe from the vaccine, and that all falls under the mandate of National Drug Authority. We also ensure that this vaccine is efficacious, meaning if the animal is vaccinated against rabies using this vaccine, the body should be able to generate immunity that should protect it from the rabies virus, so that if it is now bitten by another rabid dog, it shouldn't fall down with the disease. So our mandate as National Drug Authority is ensuring quality, safety, and efficacy. And how do we do this? As National Drug Authority, we have different control measures in regards to effecting our mandate. We look at the vaccine right from the point where it is manufactured. We go to the manufacturing outlet. Our team, we have a team of experienced inspectors who go and they do what we call GMP inspection, good manufacturing practices, to ensure that the vaccines that are manufactured for our country meets the quality standards. So whoever intends to import vaccine or manufacture vaccine for the country, we must have inspected the facility. Whether it is in Europe, whichever country, India, we have to make sure we have inspected the facility.
What are some of the available vaccines?
We have quite a number of brands of vaccines on the market. We have Rabicine, we have Raksharab, coming from different manufacturing facilities, but all of them meet the minimum quality standards because as National Drug Authority, we take charge and ensure the vaccine have been verified. We also control its importation. When this vaccine arrives at the point of entry, we have to make sure we verify to ensure that what has been released from the manufacturing company reaches when it is still safe, and then also regulate the distribution and supply of these vaccines. So premises that keep these vaccines, whether in public or private sector, we endeavor that we inspect the premises to make sure that they meet the minimum precautions, they meet the minimum standard to store the vaccine. Vaccines are quite delicate substances that if not stored well, instead of protecting the animal, it will endanger the life of the animal. So what we do is, if anyone intends to keep vaccine, because these are classified under Class B drugs, they are supposed to be handled by highly qualified people. So premises like pharmacies and hospitals, clinics with qualified veterinary professions and pharmacists are the ones who are allowed. So we look at the qualification of the personnel and the premise that is handling this vaccine. They should be having the minimum requirement. With the vaccine, like for this rabies, it is supposed to be stored between 2 to 8 degrees Celsius. That means it has to be kept in the refrigerator. And in order to ensure that it is monitored well, the person handling should ensure there is a power backup. So we continually come and assess, even after we have already authorized the vaccine to be on the market. We move ahead to come and do post-market surveillance. We continue to assess whether the way it is being stored still meets the minimum standards. Because much as we are advocating for vaccination, if the vaccine loses its potency, then definitely we are giving something which is already dead or something that would be more virulent. What the public needs to know is these vaccines are live attenuated. That means it can end up becoming more virulent and cause more infection if not handled well. So we have to make sure that we continue to monitor the outlets that store this vaccine to make sure they maintain cold chain. And then also we have an active team of pharmacovigilance officers who continue to monitor any effect that comes as a result of use of this vaccine. Vaccine, just like any drug, can have potential to cause harmful effect. So our team of pharmacovigilance continually keep engaging animal health workers, the users, the end users, the animal handlers, so that if there is any resultant harmful effect arising from any drug or a vaccine, it has to be reported to National Drug Authority. We investigate and find out the root cause. All these drugs, before they're allowed to be put on the market, clinical trials should have been done to document safety profiles. So it is done through stages, but some of the harmful effects may have been missed during the time of the study. So if any is realized at the time of use, it has to be reported so that we can address that too with the manufacturer. So as National Drug Authority, we contribute a lot to control of rabies by ensuring that the vaccine that is used meets the minimum quality standards. The vaccine has to be safe. The vaccine should be efficacious.
What about the mass vaccination of pets, especially dogs?
Dogs being the the main transmission agent for the virus. They are the ones that are supposed to be targeted for vaccination. So ideally, it is estimated that 95% of rabies cases in human are actually coming from dogs. That is why the main focus of vaccination is geared towards control of rabies in dogs. And for effective control of rabies, you need to have vaccinated 70% of the dog population. That means if in your village you have about 1,000 dogs, at least a minimum of 700 dogs should have been vaccinated. So we also ensure we continue to give knowledge and sensitization to animal health workers so that they can advocate and vaccinate the percentage that can control rabies virus in the country. So we continue to do sensitization at sub-county level, district level, to create awareness on the safe use of vaccine, on the safe handling of vaccine. The main challenge that we have sometimes is about how the vaccine is stored and distributed. Some of the challenges that we have been encountering is that many facilities at the beginning may be having the minimal requirement, but along the way, sometimes you find when power goes off, they may not be having reliable power backup, and that puts a question toward the quality of the vaccine. So we tend to make on-site visit time and again to ensure that these vaccines are actually being stored and distributed in the way that's supposed to be, in order not to tamper with the quality.
Insightful submission by the regulatory officer at the National Drug Authority, that is Dr. Wilfred Opita. Like I mentioned, there are 3 veterinary doctors in this studio with me, with whom I'm sharing this very pertinent discussion on World Rabies Day, a global event that helps us to enhance global advocacy on rabies control, and also it also provides an opportunity for enhanced or heightened awareness creation and also vaccination campaigns. Like I mentioned before, 3 veterinary doctors. Let me also bring in Dr. Anne Rose Ademon. She's the Commissioner, Animal Health at the Ministry of Agriculture, Ministry of Agriculture, Animal Industry and Fisheries. Dr. Anne Rose Ademon, as the main method for controlling rabies, what is the national coverage for rabies vaccination in pets in Uganda?
Our estimated population of pets is about 3 million. And
3 million, the whole country?
The whole country, that's our estimate. Currently, our coverage is about 1 million. In fact, more than 1 million. Because in the last 3 years, government has brought in 1 million vaccines in total. We have also, for this particular campaign, we have received 1,500 doses from the OIE, that's the World Animal Health Organization, which is based in France, and the regional office in Nairobi. They supported the campaign. We also have organizations, non-governmental organizations, that carry out mass vaccinations of dogs. I think the the largest one is Big Fix. We also have small animal clinics that provide vaccinations, and they procure their own vaccines and so on. So we are talking about a vaccination coverage of nearly 2 million pets, dogs and cats. That's the coverage. So we think that we are moving towards the population, the coverage of 70%, 75%, which Dr. Pira talked about. The reason we aim at as large a number as possible is because, for instance, if the dogs are near a wildlife reserve or a national park, and they would be bitten by foxes, which are a reservoir. Because this campaign is first to look at the transmission by the domestic animals. The dogs,
then we look at the cats, the bats, and the foxes.
We are not talking about the wildlife. But when you have a coverage of 70%, 75%, and the dog is bitten by a fox, for instance, it is protected. So the coverage will help us to make sure that no wildlife rabies comes into the domestic.
Let me get this straight for the purposes of the viewers who are watching the show right now. Dr. Anne Rose, you're saying if a fox that has rabies bites a dog which is vaccinated, it won't get the rabies?
No, it won't get the rabies. And vaccination, I want also this one to come out clear that vaccination is an annual event.
Right.
So the vaccine protects, the immunity of the vaccine protects the animal for 1 year. So every year you must bring your dog back to the vet for vaccination. The Ministry of Agriculture has produced vaccination certificates, which now tell where we have records of when the dog was vaccinated, when it is due for vaccination, so that it's a reminder. And we also want to encourage that you, as families, we involve the children because they love the pets, and they will be keen as watching the vaccination certificates so that people come back for vaccination. So I'm talking about 50% vaccination coverage as we speak, but we are going strong, and the government of Uganda is continually supporting, and we are looking at eradication of rabies alongside the rest of the globe in 2030. So we are here in this studio to talk to you who are listening, to work with us and sensitize. I was talking about that even if you wake up every morning and told yourself that I'm going to talk to just one person about rabies, by the end of the year you have 365 people. And also tell those people, to each one of them, make sure that at least every morning they talk about rabies. So the sensitization is what we are talking about today. We talked about it last year, and we are emphasizing it today, that please, this is a disease that's preventable. It is not like COVID-19, which doesn't have a vaccine. This is a disease which is vaccinable against.
And if a dog is vaccinated and it bites Romeo Busiku, would I get rabies?
You wouldn't get rabies.
Nice.
That also should come out clear, that not every dog bite is a rabies. It means that you get rabies.
The dog must be infected first.
The dog must be infected, or the cat must be infected, or the human being. But otherwise, bites are there, and that's one of the things which I want to bring out. The vaccination of a dog costs $0.2 US. That's less than 1,000 Uganda shillings. However, when the person gets bitten by a rabid dog, it will cost us about $10 US to treat that person to completion, let alone what the Uganda Veterinary Association president talked about, the other associated costs. Only the vaccine will cost about $10. So colleagues, friends out there, if we all put our work together and we vaccinate our dogs, we are saving from about to nearly 100% of the cost. $0.2 US versus $10 US.
Amazing.
Which is expensive.
Dr. Anne Rosa Demoon is the Commissioner of Animal Health at the Ministry of Agriculture, Animal Industry and Fisheries. Let's now talk about awareness creation on rabies with Dr. Sylvia Baluka, the President of the Uganda Veterinary Association. Now, Sylvia, rabies is considered one of the neglected zoonotic diseases in Africa, Asia, Southern America, and so many other countries. What specific activities have we undertaken in Uganda to increase awareness on rabies?
Thank you so much. The awareness activities include, for instance, via social media, we've sent out messages. We are now here for the same purpose, but I know that television talk show only reaches a certain number. Not everybody has television. We also are using radios. I've sent out messages to all the district veterinary officers in all the districts in Uganda to organize activities at the district levels, and already the DVOs have been in the field. As they vaccinate, they also talk to the animal owners, they talk to the general public, they talk to the leaders and opinion leaders in their areas, but they also use the free airtime on the local radios to educate people. All the DVOs, that is the district veterinary officers, are doing that in all the districts of Uganda. And in the past, we have also put newspaper articles, newspaper pull out, still for the purpose of educating people. We also print brochures, information, education, communication materials. that we give out to people for free. As Uganda Veterinary Association, we have also produced a UVA Times newsletter, a quarterly newsletter that we produce every quarter. This quarter, the September issue, we have dedicated it to rabies. It has a number of articles talking about rabies and what we can do to protect ourselves. So we use every available platform to send out messages. We had organized a rabies run 2020, which was supposed to be a major fundraising event, and we had started the meetings in February, and then COVID arrived from China very fast. It disorganized our planning, so that major fundraiser, the rabies run, we were calling it RR 2020. It was paused. We had also organized a major workshop, which FAO, Food and Agriculture Organization, had already committed to fund, for us to bring together different stakeholders, including the media, to discuss and agree on a way forward. What works for Uganda? What can we do? I know there are countries that have made laws to make vaccination mandatory. If you own a dog or a cat and they come to you and you cannot show proof that it's vaccinated, there's a penalty that you pay. And in that way, they have compelled people. Uganda still, our law doesn't make it mandatory. It would be good to have that, to make it mandatory. Actually, the strategies that can help us to end rabies by 2030, besides vaccination, is responsible animal ownership. People being responsible for their animals. Many dogs you see loitering around, people think they are strays. But I discovered that they're not strays.
They go back to their owners.
Yes, they go back to their owners. Most of those dogs belong to people who are not being as responsible as we expect them to be. So responsible dog ownership is very important. People need to know their responsibilities. I've been to some countries, some states where if you leave your dog to impregnate your neighbor's dog, you pay a fine, there's a penalty, you take responsibility. And because of that, people are more responsible. I think Ugandans are waiting for that law. They are waiting for a law that will force them to take their dogs for vaccination, that will force them to stop their dogs from producing when you don't need if you don't want more puppies from the dog, then you better stop it, because the dog will never think about family planning by itself. The owner has to do that.
Indeed.
And it's one of the strategies. If we control the dog population, we only let the dog produce those that we need. Then we limit the population. It's one of the strategies we recommend if we are actually to end this rabies.
You're right. 3 million are so many dogs. And this year's theme is about collaboration. Who are the partners in this cause? And also, how, who, and where? Let me see. I wanted to ask you a very pertinent question, but let's first talk about the partners in this cause. Yes.
The partners, if I was put it in Luganda, the nanyini mufu is the Ministry of Agriculture, Animal Industry and Fisheries. That's why our Commissioner, Animal Health, and also the Chief Veterinary Officer for Uganda, or the National Delegate who represents Uganda at the international platform. She's the one. She's from the ministry. I am from Uganda Veterinary Association, which is an umbrella body for all veterinarians. We are working together. National Drug Authority is a regulatory body that is responsible for the safety and efficacy of the medicine that come into this country and authorization of medicine to come here, as he said. As I said, we had been in discussions with Food and Agriculture Organization of Uganda. We had already had like 3 meetings with the team there, looking at, even we had already made a list of the stakeholders to invite to consult. And then COVID arrived. So Food and Agriculture Organization, FAO, Uganda, has been a partner that we work with. Even USAID has been a partner that we work with. We also have some USAID projects that have even supported production of materials. There are some materials that Commissioner's Office has produced, the procurers, the pull-up banners, and the wall banner, all that we got support from some partners. So NGOs, different projects, are always on board.
I'm sure you forgot.
We're also working with
I'm
a college.
You forgot Nation Media Group.
Nation Media Group, save the best for that. Nation Media Group, the media is always with us. That's why even in the consultative meeting we are calling the media, all the media houses were represented. Then we have Mackay University, the College of Veterinary Medicine, always supports us. We always work together. We're actually going to have a webinar next week on Monday. that is organized and moderated by the College of Veterinary Medicine,
Right.
Animal Sciences and Biosecurity. So different partners, different stakeholders.
All the stakeholders, Dr.
involved.
Sylvia has mentioned, thank you very much for holding hands together to ensure that we
And
end
mental
rabies.
health.
We should continue to collaborate and vaccinate so that we end rabies wholesomely out of Uganda. 3 million dogs are too many. Can we have a law that compels pet owners to go and vaccinate their pets? That's a pertinent question. Let me also bring in Dr. Rose and Ademun. Let's talk about policy issues. Shouldn't we be having a law that compels people to vaccinate their dogs?
Indeed, the policy, the law is there. There is the Rabies Act, and it compels people to vaccinate their
So what
dogs.
is happening? Why is Dr. Sylvia complaining about this?
It's not reviewed to a level that the enforcement is
Right.
not. You know, the law has to be activated by regulations and all that, and we are in the process of doing this. So we will, and we also want to come in slowly. That's why I told you that we are making sure that government makes a coverage of all the dog population by providing vaccines, and also we are giving the certificates for vaccination, and each one of the persons are now registered. The ones that we have vaccinated for are registered. So after that, we will come with the enforcement of this law, and we will come slowly. We want to be friendly for now, but we are informing you that the law is coming up and it will catch up with you. We want you to own your dogs in a responsible manner. We want you to vaccinate all your pets and ensure that they are housed. All those things are going to come in our laws and rules and regulations that are going to ensure that the implementation is done appropriately. So
is
we are
the
going to go
community
there.
response to these vaccination campaigns considered adequate?
The community response is adequate, especially the fact that people know that rabies is a killer disease, because nearly every community in Uganda has faced a death of a human being on rabies, or they know about it. So people respond. We have also told you that, actually Sylvia talked about it, that right now, the whole of this week, there has been vaccination in the whole nation. So all veterinary district veterinary officers have collected vaccines, and they are vaccinating in their districts. So all this is heightening the awareness, so that at the time when we reach to implement the regulations that you must own your dog, you must put it on a leash, you must house it, it must not go roaming, those laws, those regulations and enforcement are coming, and we don't want to be running around with people in jail, but we want to sensitize people, and slowly we'll be there.
If you're just joining us, we are talking about World Rabies Day, a global event that helps us enhance advocacy on rabies control, and also it provides an opportunity to heighten awareness creation and vaccination campaigns. Well, Dr. Anne Rose Ademun has mentioned that we have a Rabies Act, yes, but the problem is the enforcement and implementation of the same law that compels people to vaccinate their pets. But then we would like to know, Dr. Anne Rose Ademun, what is government doing to ensure optimum response to these rabies vaccination campaigns?
Like I told you, that government is buying vaccines and making sure that there is no excuse, the vaccines are available. The vaccines are provided to the district veterinary officers, and the district veterinary officers ask people to bring their pets either to the district for vaccination, but also there are some campaigns in different sub-counties, depending on the district veterinary officer. But right now, like this particular week, there are several campaigns, and the campaigns are given, the information about the vaccination campaign are given on radio, and these days there are so many radios out there. Please bring your dog on such and such a day under such and such a tree, and so on, and they are vaccinated. Yesterday we were vaccinating, the vaccination was launched by Honorable Minister of State of Animal Industry in Chiengera sub-county. I think that's a sub-county of Wakiso district. So several dogs were brought in there. About 500 dogs were vaccinated yesterday only in Wakiso district. So the people were informed, and they brought in the dogs and they were given their certificates to go with. And that certificate will keep on reminding them that next year. So when you have that certificate, when your dog is vaccinated, when we have created awareness, then we shall inch in with our enforcement to ensure that by 2030, we are working with the rest of the globe to eradicate rabies.
Let me also bring in Dr. Wilfred Opira. He is a regulatory officer at the National Drug Authority. By the way, Mr. Dr. Wilfred Opira is also an animal welfare activist. I hadn't mentioned that before during my preamble, but you are an animal welfare activist. And in that capacity, what other methods do you think we should employ as Uganda to control rabies aside from vaccination?
Thank you once again. We have highlighted that vaccination is the main control measure, but I must emphasize that animals have what we call freedoms. There are 5 animal freedoms that we must observe in order to ensure that they meet their needs. One is freedom from hunger and thirst. If your dogs do not get adequate food and water at home, that is the reason why we shall find them on the street in garbage pits looking for food. Dr. Sylvia Baluka highlighted why we need to emphasize on responsible dog ownership. Responsible dog ownership means you need to take care of your dog at home to meet its requirement. So if your dog is not fed well, if it doesn't take adequate water, definitely it is going to go on the street looking for what to eat. There are only 2 reasons why most dogs normally go out of home. 1, looking for what to eat and drink. 2, probably during mating season. They can be running after a female dog which is on heat. So if you can take responsibility and confine your dog at home and feed your dog properly at home, definitely we are not going to have cases of stray dogs roaming on the street. Another approach is also to ensure we manage dog population. If you have dogs at home and you're unable to keep more, you need to do what we call take them to a nearby veterinarian to do what we call a spay for a female dog, that is removing the organ, the female reproductive organ, so that it does not produce unwanted puppies. It is these unwanted puppies that are normally thrown back on the street to go and look for, fending for food. And there you'll end up getting bitten by a rabid dog. It may come back home and even infect animals at home and even human at home. So if we do targeted population dog control, also we are going to see a change. So on top of vaccination, we need to emphasize on responsible dog ownership, and we need to also emphasize on dog population control. And sanitation? Sanitation, definitely. That is why we have, among other stakeholders, we are talking about collaboration. Here in Kampala, we have Kampala City, Capital City Authority. If we don't manage garbage well, because why do we find dogs where food is just thrown anyhow on the street? So if we don't manage garbage well, definitely that is where we are going to have what? Stray dogs coming in because they are fending for food. So if we keep our environment clean, we manage garbage well, we don't throw food waste anyhow, they will have nothing to eat on the street, definitely they will go back home. So if we manage garbage well and we do responsible dog ownership at home and targeted spay-neuter program. Well, thank you very much, Mr. Wilfred Opira, a regulatory officer at the National Drug Authority. Let me also bring in Dr. Sylvia Baluka Angubua. She is the president of the Uganda Veterinary Association. You told us who the partners in this cause are, including Nation Media Group, of course. But then we'd also like to know how, where, and who should participate in the World Rabies Day activities.
Thank you so much. As I said, from the very beginning, when this day was earmarked in 2007, collaboration was behind. The spirit of collaboration was behind all the discussions and the strategies.
Let's focus on the participants. How, where, and who should participate in the World Rabies Day activities?
Okay, thank you so much. World Rabies Day activities, all animal owners should participate. Okay. The community leaders should participate. Okay. Religious leaders should participate, because usually when we have a dog biting someone, it goes beyond an individual and household to actually becomes a community problem. So those should be involved.
Where are the activities?
Minister of Health needs to take more interest in World Rabies Day. I've been discussing with the commissioner in charge of veterinary public health and zoonoses. And we had actually planned to have these film vans drive through all the divisions of Kampala on a daily basis for 1 week. We've not been able to actualize it now, but we are still planning with the Commissioner, Assistant Commissioner and Minister of Health. But we think Minister of Health can do more. Right now, veterinarians were at risk, veterinary students are at risk, because we start touching animals even as students before we are protected, which is not acceptable. So we expect Minister of Health to do more. We expect that district local governments to do more. We expect Minister of Local Government to come on board, because right now many things are done at the district local government level. So all those should come in. Then the training institutions like Mackay University.
And my final question goes to Dr. Anna Rose Ademon. She's the Commissioner of Animal Health at the Ministry of Agriculture, Animal Industry and Fisheries. In case of exposure to rabies, what should someone do?
Once you're bitten by a suspected rabid animal, most often it would be a dog, please rush to the nearest health center. But at home you can wash off the wound, because the target is to remove as much as possible the saliva which is infected, which has a virus in it. So the wound should be washed. There are challenges where people want to keep the wound dirty so that they report to the LC and say that as evidence
to get
and
money
to police
from the other
to get
person.
money.
Wow.
Please, I advise you that if you can do that complaint, but for the sake of your health, please wash that wound as clean as possible. Report to the nearest human health center, and the human health personnel will clean the wound, do what we call debriding, removing any rugged areas of the wound, and wash it and disinfect as much as possible. So the target is to remove as much.
What are the treatment centers?
At the treatment centers, every district hospital must have what we call PEP, the post-exposure prophylaxis.
Right.
So every hospital should have, and this drug is free of charge by government of Uganda, and it is provided at the national medical stores. So every district should collect their PEP as a stock for from their district. So after you are attended by the smaller clinics, the questions that will be asked by the medical people is to try and understand whether this dog is actually rabid. So, or the animal which has bitten is also rabid. So this person will now go to the facility, the hospital where the anti-rabies vaccine is, and the persons are treated. There are 5 doses, and the doses are day 0, day 3, day 7, day 14, and day 28.
And on that note, we've come to the end of this show. My name is Romeo Busiko, and I've been having this insightful conversation with Dr. Anna Rose Ademon, the Commissioner of Animal Health at the Ministry of Agriculture, Animal Industry and Fisheries. And also in the middle, we had Dr. Wilfred Opita. He's a regulatory officer at the National Drug Authority. And finally, the president of the Uganda Veterinary Association, that is Dr. Sylvia Baluka Angubua. Many thanks for having made the time to talk to NTV Uganda. And to you at home, please, to end rabies, we have to collaborate and vaccinate. Go out and make it happen. Good evening.